Good morning. My name's Oscar Perez. I'm an SGU MPH candidate, and today I would like to talk to you about salmonellosis. Salmonellosis is a disease caused by the Salmonella bacteria. Yearly, the Centers for Disease Control, or the CDC, estimate that Salmonella causes about 1.2 million illnesses, 23,000 hospitalizations, and 450 deaths in the United States every year. Here's a microscopic picture of what Salmonella looks like. Salmonellosis is a zoonotic disease, or a disease that is transmitted from animals to humans, that has a number of animal reservoirs. Animal reservoirs refers to a species of animals or groups of animals that often have salmonella and don't have salmonella eradicated in them. So there's always a source of salmonella in them. Salmonella bacteria are flagellated. This means that they use a hair-like appendage to move around in the body. The bacteria spreads in the body, so it goes from one section of the body to another through the blood. Here's a diagram of what the flagella looks like. Salmonella has the potential to infect many people at the same time with a serious disease. There have been a number of outbreaks in the recent past that have led to a greater spotlight being placed on salmonella. One of the places that has received a lot of attention is the food and pet industry, as outbreaks are often linked to animals that we either consume, breed, or keep as companions. Since 2016, the CDC has listed 7 animal-linked salmonella outbreaks. Dairy calves in 2016, live poultry in 2016, live poultry again in 2017, pet turtles in 2017, live poultry in backyard flocks in 2018, pet guinea pigs in 2018, and pet hedgehogs in 2019. Salmonella can be transmitted in a number of ways. It can be ingested in contaminated food. It can be passed from human to human, and it can be transmitted from animals to humans. The list of food that is commonly associated with salmonella includes vegetables, eggs, chicken, pork, fruits, and even certain processed food. In particular, eggs, chicken, and pork are food items that are generally associated heavily with the salmonella. So physicians may look for them often in their history taking. Animals that commonly transmit salmonella, so directly, not just through food, include poultry, so a number of birds, pigs, reptiles, like turtles and lizards, and frogs. Maintaining good hygienic practices help to eliminate some of the risks being posed by being in close proximity to these animals. So hand washing can be very useful in preventing transmission. In addition to keeping mucosal surfaces like the mouth and the eyes far away from animals, so not in contact with. So what happens when somebody is infected with salmonella? Following the introduction of salmonella in the body, there are a few signs and symptoms that can begin to develop within half a day to 3 days of the introduction of the bacteria. These symptoms include headache, fever, myalgia, another name for muscle pain, abdominal pain, and diarrhea. The main symptom of salmonellosis is diarrhea. The diarrhea can even be bloody. While salmonellosis generally lasts 4 to 7 days, vulnerable patients can develop bacteremia, which is a dangerous overgrowth of certain bacteria throughout the body. Sepsis, which is a very common, a very dangerous condition that is a progression of bacteremia, and osteomyelitis, bone infection, which is common, which occurs to sickle cell patients who contract salmonella. Additionally, in some cases, patients who have had salmonellosis can later, after the infection goes away, develop reactive arthritis, which is a condition that causes pain in joints. Salmonella can be identified by physicians through the following ways. History taking is generally very important to help physicians suspect salmonellosis. Um, if the symptoms mentioned before are found, like headache, fever, myalgia, abdominal pain, and diarrhea, those aren't specific enough to say, okay, this patient definitely has salmonellosis, but it can help physicians suspect it more. In addition, the history taking has to include contacts that the patient has had. Have they been in contact with people who have salmonella? Have they been in contact with a number of the animals that I mentioned recently? Have they eaten any food and then developed these symptoms? The food that is associated with salmonella. Salmonella infections are confirmed, however, and diagnosed through growing cultures from blood or fecal samples. That's the main way that the definite diagnosis is done. Serotyping is also often performed for salmonella. Serotyping is the specific identification of the subtype of salmonella bacteria that is found. Successful serotyping has a number of benefits. Aside from understanding the exact type of bacteria that a patient is being affected by, serotyping plays a key role in determining the source of the infection. This can be very important in the prevention of an outbreak or in the ending of one. There are some people who are more vulnerable to salmonella than others. Salmonella infections are more common in the summer and affect those that are under 5 years old more frequently. Additionally, patients who have sickle cell disease, who contract salmonella, as we talked about previously, are more at risk of also developing osteomyelitis. More severe infections can occur to the young and old, and those who have weaker immune systems. Finally, there's been a growing concern about salmonella and antibiotic resistance. Salmonella is not generally treated with antibiotics. That's something I'll get into a little bit later. But when patients require antibiotics, the expectation is that the antibiotic will take care of the bacteria. However, a growing resistance in this bacteria means that the patient will continue to be sick even after antibiotics are used. As per Brown et al.'s study in 2016, antibiotic resistance has been associated with more severe illnesses and more adverse outcomes, including high rates of hospitalizations, longer duration of hospital stays, and higher mortality. So how do we protect ourselves from a salmonella transmission? The most important work that is done to prevent the infection of people is the regulatory work that is done by the FDA in the United States. The FDA is in charge of taking care of all the food that is consumed by the population. The more stringent that these regulations are, the more stringent the regulations that are placed on animals, the better for the likelihood of us becoming infected with salmonella. In addition, regular testing of animals for infections, their living conditions, and their transportation will help to decrease infection rates. Pets, on the other hand, require a personal touch. General care general care is important. So regularly testing animals and curing pets who have an infection can limit transmission rates. It's also important to understand that getting close to other animals, particularly at petting zoos, can be dangerous because these animals are not under your supervision, so they may not have been taken care of the best. Like as mentioned previously, maintaining general hygienic practices will also help to decrease transmission. A recent approach that has been considered to treat food is the use of viruses to control bacterial population. That may sound a little counterintuitive or crazy, but In fact, the use of lytic phages for biocontrol of salmonella in the food industry has already been under testing. So what happens when somebody contracts salmonella? Treatment of salmonella is symptom dependent. That means that the state of the patient will determine if there's a need for non-supportive treatment. So generally, patients who have a salmonella are treated supportively. So they're hydrated, and their pain is managed, but they're not usually given other medication. Individuals who are at risk of complications like sepsis should be treated with oral quinolone or TM SMX antibiotics. The use of antibiotics should be limited to key cases to prevent antibiotic resistance from continuing to spread. We talked about how dangerous antibiotic resistance could be. Prudent use of antibiotics will be important for many diseases. When salmonellosis outbreak begins, so does the investigative work to track down the source. Salmonella outbreaks are dangerous. Hence, one of the key aspects of public health in treating a salmonella case is to make sure that it doesn't spread further, or to stop the spread immediately. The first step is to serotype the infectious agent, determining, and when the serotype is done, it can help to determine the area and the location or the type of reservoir that this particular bacteria is found in. So serotyping is very important, and the work can begin then to stop any further outbreak from occurring. Here are some of the references I used to pull this presentation together. Thank you very much for your time, and I look forward to fielding any questions you might have.